grateful. I'm very grateful to have these medications available to me to help sustain my kidney function and not reject it.
I feel great about it if that medicine is saving my life and keeping me going.
A very small price to pay for health and life and extended life.
I've accepted without reservation that taking meds for the rest of my life is a small price to pay for still being alive today and enjoying life with my growing number of grandchildren and a loving family.
I feel that it's an opportunity to have a better life and to prolong my life. As opposed to being on dialysis, to me, there's no comparison of the two.
The risk of developing cancer, specifically PTLD, that's a little bit scarier for me.
Puts me at risk for cancer and for a host of other problems.
The long-term side effects of these medications.
That basically you're taking medications to help save your kidney, but in the long run, it's actually going to cause more damage than anything.
It's the push-pull of the medication. I can never really feel happy that I'm taking it because I know that every time I swallow it, it's doing something good and something bad.
I guess the only burden you might feel at times is the collateral damage that is brought on by the use of immunosuppressants.
Well, I used to be concerned about the high price of our meds over the years, especially with generics coming on board. That's gone from thousands of dollars per refill years ago to my copay last week of just $1.50 for 3 months of tacrolimus.
With the Prograf, I believe that my kidney is failing currently because of the Prograf that I've been taking on it for such a long time.
I'll be very honest with you. I was concerned about that. I was concerned about being vulnerable to infection and disease.
Problem with transplant medicines, and I can only speak to heart transplant, don't know the other transplants really. We take these medicines, but they don't really do the job, do they?
Prednisone. I take a very small amount, only 2.5 milligrams at night, but I do get side effects from it.
I noticed that a lot of transplant patients get the puffy face or whatever. I fight like crazy for that not to happen.
Prednisone and Prograf, I would have to say, would be the two medications that I would highly not like.
Even though my doctors and others have said that I shouldn't have side effects from such a low dose, but I think it affects everyone a little differently.
Because of the symptoms that are related to taking prednisone, cataracts, I've had skin cancers removed on this ear right here. I've had partial it removed.
It has to be timed when you have a blood draw to find out your level. And the reality is you can never really get the blood drawn at the perfect time.
I've had 7 or 8 places removed on my back. I constantly have to get my eyes checked. The prednisone making my bones weak.
Get a lot of facial swelling. I have swelling on my shoulders and in my abdomen, and I do get pretty severe acne.
It could damage my kidneys. I'd have an increased risk of cancer, etc. But I figured that was the trade-off. Live and survive or don't. So I did what they told me to do.
That you have to take it. It's going to be a part of your life the entire time that you have that transplant, and it's not a choice. So that's something you need to be fully aware of and truly understand.
It's very serious that one comply with medications. Very often somebody's died so you could have an organ. It's going to take a lot of time, a lot of anxiety, a lot of money.
You really have to make a system for your medications. It can be confusing with a lot of the different types of medications, and they change over time, so you have to understand what's needed daily.
You're not guaranteed to feel so great on the medications, especially if you're not used to them. So it might take your body some time to adjust to it.
To make sure that there's somebody else, a partner, a spouse, a very close friend, who can go through the orientation with you on medications.
Laying out my medications for at least a week in advance.
Just being mindful of taking my medications at the right time and the same time every day. And I quickly learned that getting a pill organizer was the right thing to do.
You have to be disciplined. Meds are your priority, along with eating, sleeping, and exercise.
To take the medications out of the pharmacy containers and then put them into my pill organizers.
Listen to your body. That's the most important thing. Making sure that the medications are working, you're your first line of defense. If you feel different, contact your transplant team or your doctor and let them know what's going on.
This pill container so I could prepare my medications 1 week in advance.
One of those tools is, first of all, my smartphone. And my smartphone alarms are set for 12-hour intervals every day of my life.
You really have to take ownership of it and make it work for you.
Automatic reminders to take my immunosuppressants at the same time every day.
Took the meds when I was supposed to take the meds.
These organizers where you can set up your medications for 7 days and 4 periods during those 7 days.
My dosages changed a lot that first month, and I started preparing my medications 1 dose at a time and 1 day at a time.
Do your research so you don't get in a big financial bind.
And I carry some immunosuppressants in my gym bag and in my backpack, so they're always there when I need them.
And the final small thing I bring is one of these little plastic containers where I can put my medications for the evening if I happen to be out and about and unable to have my regular containers with me.
Taking them just became another good habit, like having a good breakfast every morning or brushing my teeth. One transplant for life, and life is good.